Ted here at Really Help You. Today is Therapy Thursday, and I figured we would talk about how to stretch properly the calves, the quads, and the hip flexors. Kind of three areas that are pretty tight on a lot of people. And the biggest thing with this is we're trying to stretch the muscle. We're not trying to shift like the bones or pull the bones away, if that makes sense. But so we'll start with first the calf stretch. And basically, I guess what I'm trying to get across is that we stretch in more of like a neutral alignment rather than stretching and allowing those muscles to pull us out of alignment. So when you stretch your calf, for example, let's say we do this stretch, and the biggest mistake that I see, if you can see my foot, is people will or clients will pronate while they stretch their calf. And then basically all you're doing when you're stretching is you're just stretching into pronation. So you're just becoming more flexible in pronation or over pronation, right? So we don't want to over pronate. So being aware of that, looking at your foot, making sure that arch is nice and lifted, and making sure the ankle and foot is pretty neutral when you're stretching the ankle. When you stretch, and then some people will rotate their foot out. Now it's not necessarily wrong to try to stretch in different angles, but again, it's just about not stretching into that overly pronated position. Or if you tend to walk with your feet out, I would advise you not to stretch with your foot rotated out, because again, you're just stretching into dysfunction, we'll call it, rather than stretching properly. Okay, rather than getting the muscles stretched out to where they can work better, rather than stretching them to work as they are. Next one is the hip flexor stretch. So again, a common stretch for the hip flexor, we'll just go over one, is you just feel a nice little stretch here. The muscle, so the psoas, the rectus femoris, they can pull your pelvis forward and it can arch your lower back as you stretch. And that's not going to benefit you as much as if you can try to level out your pelvis and then stretch from here, get a little activation of that back glute, and that's going to give you a much better stretch. And again, it's going to stretch you in the proper way rather than going to this and it's pulling you more in this direction. So it's just about finding that level pelvis and stretching in that position, the hip flexors, versus pulling yourself into this anterior pelvic tilt. All right, so that's the second one. The third one is the quads, and it's the same concept as the hip flexors. When you're stretching your quad, again, the pelvis can get pulled forward. So I typically recommend, if you can get a little bit of a glute activation again, that also helps relax the front line a little bit due to reciprocal inhibition. But you can also get a little bit of abs here too, and that's going to help keep your pelvis again in a neutral position. Even if I'm not a stickler with like, make sure you're the perfect alignment here. The biggest thing is I want the pelvis to be level, even if the knee has to be out a little bit. And yeah, so just be aware of that, especially when you're moving. And it's important for you to have that flexibility to do that, because then when you go to do other activities, your pelvis can stay in a better position rather than being pulled in one direction or the other. All right, so you got the calf stretch, keeping your ankle neutral. You've got the hip flexor stretch, keeping your pelvis level with a little glute activation and abs. And then the quad stretch, same idea. If you can get a little glute activation and abs just to stabilize the pelvis, you're going to be much better off, rather than moving from the lower back, stretching from the lower back, making that more mobile, which is what we're not looking for. We're looking for a nice stable center, and then we have nice mobile active hips. Okay, so that's it. Let me know what you think. That was Therapy Thursday, and I will see you tomorrow for Food Friday.